This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and welcome to Your Health. I'm Barry Morgan. Did you know that it's not always necessary to go to a clinic or a hospital to have access to a health care professional? It's true. If you or someone close to you isn't feeling well, you can pick up your phone and call 811. That's Info-Santé. And to tell us more about this service, we have in studio Kamelie Truong. Ms. Truong is a clinical nurse at Info-Santé 811, a regional service managed by CIUSSS West-Central Montreal. First of all, welcome. Thanks for being here.
Thank you.
What exactly is Info-Santé 811?
Well, actually, it's a health line that you call. Whenever you call, you can reach a nurse on the phone, so she can answer your question about different concern that you have, your symptoms. Then you don't necessarily always have to go to the emergency or clinic. Nurses can assess your symptom and tell you what you should do, what you should monitor, and when you should go and get medical attention.
It's sort of like a triage system on the telephone?
Yeah, kind of, but a triage, what is different with a triage at the hospital is because at the hospital, nurses can assess quickly with the other senses, such as, she can see the patient coming, while we, all our assessment go through, the hearing.
You rely on what the person is telling you.
Yes,
Absolutely.
exactly.
Why is it better to call 811 than to head to a hospital or a clinic right away, or to call 911, for instance?
You don't necessarily need to go to the hospital for example, a minor injury, or for a gastro or flu, for example. There are so many things that you can do at home to help you get through that. And if it doesn't get better, then you can go to a clinic or an emergency if it's really deteriorating.
Okay.
But before that, you don't have to go and wait 12 hours at the emergency for that. You can just stay home and rest, hydrating. So if you call us, we'll be able to evaluate you, to assess your condition, and then tell you if it is necessary for you to go or not to seek medical attention.
What's a typical call to 811 like, Kamelie?
Well, actually, every call is unique, but we receive a lot of calls such as gastro, for example, or flu. Okay, people say that they're not feeling well, that they have vomiting, diarrhea, what they should do. So we ask people question about their condition, okay, their symptoms. Just rule out the emergency, rule out the sign of dehydration,
okay,
and then we'll give them advice. We give them what to do, tell them what to do, and what to take, and when to go and get medical attention.
It really saves a lot of people from having to go to the emergency room. So it saves time, it saves resources.
Exactly.
Really terrific. And speaking of resources, you're able to direct patients to different resources if necessary. Can you talk about that?
Yes, we can redirect a patient to their pharmacist, for example, to the nurse at the CLSC, to the social worker at the CLSC. So
it's not always you got to go to an emergency room. There's different options.
Exactly. There's situation, there's symptoms, and also the severity of their symptoms.
Right. In some cases, after all, you will send somebody to a hospital.
Exactly.
Does that happen most of the time, would you say, or sometimes, or?
It's sometimes.
Sometimes?
Yeah. Most of the cases are resolved by staying home, self-care. Okay. And sometimes we redirect to a clinic, but we give them a delay of consultation.
What does that mean?
Meaning that, you just have start to have certain symptoms. You don't need to run to see the doctor yet. You can do certain intervention at home. And if it's not improving, for example, after 48 hours of trying to help yourself with the advice that we give you, it doesn't get better, you go to see a doctor in a clinic. And if is deteriorating a lot and there's sign of emergency, then you go to the emergency.
Okay.
We will give the patient, the sign, the manifestation for them to really monitor. You don't have necessarily to go to the hospital.
I understand. And there's another side to Info-Santé, which is Info-Social, which you can also access simply by calling 811.
Well, actually, when you dial 811, okay, you have the option to choose social, Info-Santé or Info-Social.
Okay.
So you get access to the social worker or the nurse. Up to your choice.
I see.
And sometime if you can end up with the nurse, and after assessment, we can also redirect you to Info-Social also.
So it's a real team effort that goes on
Exactly.
there. And you've been there for quite a few years, at least 11 years, I believe.
11 years.
11 years. So I'm sure you've seen a lot of that, a lot of examples of that kind of teamwork that goes on there. What is it like to work as a nurse? As a clinical nurse at Info-Santé 811 and for so many years?
I really love working at Info-Santé because it's allowed me to develop my assessment skill. Mm-hmm. Okay. And also it's allowed me to help people, to give them advice, to give them tools to take care of themselves without necessarily panicking and going to seek medical attention every time when it's not necessarily.
So you're empowering people.
Yes.
You're giving them more control, in a sense, over their own healthcare needs, because you're saying, yeah, if you need to go to the emergency room, sure, you have to go. But if not necessarily, well, here are so many, A, B, C that you can do to avoid going to the ER. And let's face it, most people do not want to go to the emergency room.
Correct.
Gives you a good feeling to help that way?
Of course,
yeah.
Yes.
And I imagine after so many years, you've probably talked to, I can't even imagine how many people. It's probably got to be thousands.
Thousand of them. And it's very rewarding when people thank you, when people call back and say that you just saved them when you send them to the hospital, or that they're really happy that they don't have to go and seek medical attention and they stay home, and that they're getting better. And
plus, I'm sure you put a lot of people's minds at ease because somebody's going to call. Obviously, they're concerned. It might not be what they thought it was, and most people think usually the worst, I would imagine.
Exactly.
I'm sure you put a lot of people's minds at ease, and that must make you feel pretty good also, that you're calming a lot of nerves out there.
That's perfectly true.
Yeah.
And also, nowadays we have internet, right? So people go on online and search for different symptoms, and then they panic.
For sure.
And it's not necessarily for the good reason. So when they call us, we can reassure, we can evaluate. Of course, after the evaluation, after the assessment, we can reassure the person that, it's not necessarily what they're thinking. So it's really rewarding.
Always good to speak to a healthcare professional, that's for sure. Oh, and some people might be wondering, when you call, you're given the option French or English?
Of course, when you call 811, they're going to ask you if you want to talk to a professional in English or in French. Then you can choose option 1 or 2, depending on what you want.
And this is 7 days a week, 24 hours a day, 365 days a year this service is available.
Exactly.
Kamelie, thank you very, very much for your time. Really appreciate it.
Thank you. It's my pleasure.
That is Kamelie Truong, a clinical nurse at 811 Info-Santé. It's a regional service managed by CIUSSS West-Central Montreal. And that is it for this edition of Your Health. Thank you for your time. To hear our previous programs, you can find them at podcast.ciusswestcentral.ca. That's podcast.ciusswestcentral.ca. westcentral.ca. And let us know if there's a topic you'd like us to explore in the future. I'm Barry Morgan. Until next time.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.